Hi, I'm Dr. Michelle Mutapa from the Health Professions Advising Office. I'm the director here. Pleasure to get to lecture to your class a little bit this semester so that you get to know me, and I'm hoping that at some point you come to our office for your advising needs, whether it be allied health or health professions. For the next few weeks we're covering health professions, and for this week we're covering Chapter 9 and Chapter 20. So a lot of this covers medicine, massage therapy, and recreational therapy. Here's just a few things that you might want to consider as you're reading these two chapters. One is in Chapter 9, they really go into a lot of different specialties in medicine, which is, I think, very cool and interesting for you to learn what's out there if you're going to consider being a doctor. One thing I want you to understand is while it's great to know what specialty you might be interested in and what really excites you, you don't really need to decide at this point in your career, because what happens is you first get into medical school. That's the big exciting part, and the big success coming from undergrad to medical school. And then by your third and fourth year in medical school, you'll be doing clinical rotations anyways, where you get to observe and be a part of different specialties. And at that point, you can decide which specialty you'd be interested in. So that's just one important thing to know. Secondly, the book emphasizes that there is a need for more primary care doctors. Primary care doctors are the basic point of contact doctors that you often see when you are first sick or you first have symptoms, and then they can make referrals to specialists as needed, like dermatologists, or maybe you need to see a cancer specialist or something like that. Well, for certain, there's more of a need of primary care doctors, and I wanted to emphasize that. Especially in low-income and rural areas. And so, in fact, one of our students, she just got into physician assistant school. She is getting her school completely paid for because she's pretty much agreed to serve low-income urban areas or rural, low-income, doing work for them in primary care in those areas. So that's something important to consider as well. Thirdly, they do talk about the difference between allopathic medicine, which is traditionally known as MD, and DO, which is osteopathic medicine. So this is something that you're also going to be doing in your discussion board this week, just knowing the distinction between the two. And the two are, there's a lot of similar training for both, but DO, you learn some more extra things that you're going to get to cover watching the videos that you get to look at this week. Fourthly, one thing to understand about medicine, medicine is a career that a lot of people are interested in. And in fact, there is going to be a job growth for medicine in the upcoming years, especially as the baby boomers get into the older age groups. There's more of a need for doctors with specialties to deal with older adult patients. So there is job growth, that's promising. But also keep in mind that when it comes to physicians, job growth might be kind of dampened at the same time, because there are more other members of the healthcare field that can address healthcare needs, such as advanced practice nurses as well as physician assistants. So while there is job growth for doctors overall, some of that growth might be mitigated by the other healthcare professions that can help people. Another thing, don't ignore other careers. For example, there is some discussion of podiatry. Podiatry is a doctor who deals with issues related to the foot up till about the knee area. That's a career that I would say, compared to other careers, might be a little easier to get into in the healthcare field, that you might be a great fit for. We're covering other careers as well, such as massage therapy and recreational therapy. Both have some science background. Podiatry just as much as medical school, actually, I would say, that you might find very interesting, that suits you well, suits your lifestyle well, might take a few less years of education, but at the same time, great rewarding careers for you. So we introduce you to those in this chapter. And we're going to have you look up some of the requirements for some of these schools, just to get yourself familiarized for what it is, what can you do with it, that kind of thing. And you know what, there's even some more creative things. So let's say you love art, let's say you love dance, let's say you love music. I mean, you could definitely do those as an art therapist, a dance therapist, a music therapist. So if you have those kind of artistic inclinations, I wouldn't ignore those as just a hobby necessarily. Those can also definitely be considered as part of your career, even if you want to go into the healthcare industry. So anyways, Ashley and Ashley is my office coordinator, who's also part of providing these lectures for you. We're going to enjoy hearing from you in the upcoming weeks, and getting to know you, and providing as much information as we can, and we hope to see you in our office as well. Thank you.